I want to ask two questions. One is on the liver allocation policy. Senator Moran and I sent you a letter on January 21st urging that you step in to prevent what we thought was a short-sighted and ill-thought-out policy. Roughly 40% of the country will be harmed by the new process, which goes from a regional allocation to a nationwide allocation. We've already seen, Mr. Secretary, increased cost per transplant, increased waste in what was already a complex system, and organs that were discarded because people had to travel too far to get the organs to bring back to the recipient. Even the federal judge in the litigation referred to what would be a regional bias here. The government contractor on this effort provides no information to the committee on how the decision was made. They overruled experts in their own liver and intestine committee. Now they want to continue to have all the evidence in the litigation under seal. So my question to you is, one, what made you determine after our January letter that you couldn't do anything? And two, are you willing to do something to work to get the evidence and what supposedly should have been available to this outside contractor to make that evidence public?
So, Chairman, I share your concerns and frustrations, and HHS has actually requested OPTN to reconsider their decision to ensure a full consideration of the comments that they received from Kansas and Missouri. As you know, HHS does not make decisions on organ allocation policy. The Organ Procurement Transplant Network is responsible for organ allocation policy. And while we're charged with oversight of OPTN, those decisions by statute are delegated to the OPTN, and I do not have the ability to change those decisions. We continue to look for authorities that might do that, and we certainly look forward to working with you if there were legislative proposals that might give me authority, but those have actually been walled off from the Secretary. Of course, the number one thing we can do is increase the number of livers available, and that's why we're working to reform our organ procurement policies and our oversight policies and practices regarding the organ procurement organizations in the country so that we can dramatically increase the number of organs available in this country. But I'm happy to keep working with you on this liver issue, but my degrees of freedom are limited, quite frankly, by Congress in my ability to influence the OPTN.
Well, let's continue to see if we can't find ways to help you have more ability in that oversight process to have oversight.